Hi, so today we're going to be discussing about the ulna. So ulna is the medial bone of the forearm, and it's also homologous to fibula, which is the lateral bone of the leg. So now we're going to talk about the parts of the ulna. There is an upper end, a long shaft, and a lower end. So talking about the upper end, it has an olecranon process, a coronoid process, a trochlear notch, and a radial notch. The long shaft has a sharp lateral border, which is called the introitious border. The lower end is referred to as the head of the ulna because it's round in shape, and posteromedially it has a bony prominence, which is referred to as the styloid process. Now talking about the side determination of ulna, the styloid process should be directed posteromedially. The introitious border should come laterally, and this process, the hook-like process, should be directed upwards. So this is giving us a right ulna. Now talking about each of these parts individually, we first have the olecranon process. So olecranon process has a superior surface, an anterior surface, a lateral surface, a medial surface, and a posterior surface. So in the superior surface, towards the posterior side, we have the attachment of the triceps brachii muscle. The anterior surface provides the upper part of the trochlear notch, and in the posterior surface, there is a subcutaneous olecranon bursa present. Now talking about the coronoid process, in the coronoid process, again there is a superior surface, there is an anterior surface, a lateral surface, and a medial surface. So in the superior surface, it forms the lower portion of the trochlear notch. The anterior surface has the ulnar tuberosity, and this region shows us the attachment of the brachialis muscle. Now on the medial side, there is a sublime tubercle which is present, and here there is the attachment of the ulnar collateral ligament, the flexor digitorum superficialis, the pronator teres, and the flexor pollicis longus muscle. Now towards the lateral side, we have a radial notch. The anterior and posterior parts are connected by an annular ligament, and below that there is a supinator crest and a supinator fossa. This region provides the origin of the supinator muscle. From here, the muscle attaches towards the radius. Now talking about the two notches here, we have a trochlear notch which is attached to the trochlea of the humerus, and a radial notch which is attached to the radius and forms the superior radioulnar joint, which is a pivot joint of synovial variety. Now talking about the long shaft, there is a lateral introitious border, an anterior border, and a posterior border. Between the lateral border and the anterior border, we have the anterior surface. So in the upper 3/4, there we have the origin of the flexor digitorum profundus, and the lower 1/4, there is the origin of the pronator quadratus. Now between the anterior border and the posterior border, we have the medial surface, and between the posterior border and the lateral border, there is the posterior surface. So here in the upper part, we have the attachment of the anconeus muscle. In the lower part towards the lateral side, there is the attachment of abductor pollicis longus, there is extensor pollicis longus, and then extensor indicis. Now talking about the head, as we earlier mentioned, posteromedially there is a styloid process present, and the head behind, between the back of the head and the styloid process, there is a tendon of flexor carpi ulnaris which is present. These are the parts of the ulna. So talking about the clinical correlation of ulna, the fracture, the olecranon process, is the most common type of fracture which is observed in the case of ulna. Now other than that, there are two distinct types of fractures. One is a fracture at the upper part of the shaft of ulna, where the superior radioulnar joint gets dislocated. The other one is a fracture at the lower part of the shaft of ulna, where the inferior radioulnar joint gets dislocated. So hope you all understood about the ulna. Thank you.